healthcare, there is often too much information and not enough time. Here at the Melanin Initiative, we avoid TMI by breaking things down into language you can understand. We create a safe space for you to ask your questions and share a nursing perspective without taking too much of your time. Today, we're joined again by our special guest, Dr. Yvette Conyers. She is a doctorally prepared nurse practitioner. This is her second time on the show. If you haven't already, go back and watch her first episode with us where we talked about amputation prevention. Today, we're going to learn all about her nursing journey and her perspective on healthcare. We're going to find out her motivation to pursue her doctoral education, a little bit about her research, her perspective on the current state of healthcare, what she wants you and nursing students to know about healthcare and what it's like to be a clinician, her vision for the future, and what we can expect from her this year. If you're new here, welcome to the Melanin Initiative. I'm Dr. Kimberly Madison, a doctorally prepared nurse practitioner, and I co-host this podcast along with Alicia and Geraldine, who send their love in their absence. We are a health literacy podcast offering our nursing perspective. When we say health literacy, we're talking about the ability to obtain information, to understand that information, and to use it to manage your health and advocate for others. By watching this show or listening on your favorite podcast app, we hope you feel empowered to ask questions, educated on how to manage your health, and confident to navigate the healthcare system. If you haven't already, we invite you to subscribe so you'll be notified when we release a new episode. Thumbs up the video and leave a comment or two. It helps support us and it shows YouTube that we're valuable, and it'll bring us up higher in the search content. Quick disclaimer, remember this show is for educational purposes only. The opinions expressed here are our opinions alone. They're not a representation of any of our affiliations. If you're experiencing a medical emergency, you should seek medical attention and medical guidance from your healthcare provider. If you're having a physical emergency, you can call 911. If you're someone you might know might be having a mental health emergency, you can call 988. Welcome back, Dr. Conyers. It's so good to have you on the show.
Thank you. Happy to be here. And thank you for inviting me to share my story.
I'm so excited to share your story. You know, one of the things I'm trying to do with this podcast is just bring more awareness to the public on what it is to be a nurse. And, you know, you happen to have your doctorate, so we're going to put some emphasis on that because there's a lack of knowledge in the community and even amongst our colleagues about what it means to be a doctorally prepared nurse. And like we do with other things that are confusing, we just explain it and break it down. And so I think we can manage that.
Yes. Happy to share.
So I know we're just going to jump right into it because you are an interesting individual. So tell us your nursing journey.
Woo! Y'all ready for this? My nursing journey did not start off as a nursing journey. It started off as I want to be a neonatologist, a physician that specializes in preemies. That's what I wanted to do in 10th and 11th grade and 12th grade. My goal was to get done with high school early because I was taking all my classes. But you guess what? You know, Doc Yvette got pregnant. Senior year of high school, 17 years old. And that changed the trajectory of what my life would be. So I decided not to pursue neonatology. And that's when I took a change and detour and decided to pursue nursing. And all the while, I do look back and reflect on that and say, I didn't choose nursing. Nursing chose me. I had my son at 18, graduated from high school, walked across the stage with two of my best friends at that time, holding me up because I was just so sick. I think about that moment very, very much. I knew I didn't want to just be a statistic, a teen mom, continue to have more kids, to each their own, right? This is my story. Who was just having more kids, didn't do anything with themselves. I wound up going to a local university, Rockport State, actually, college, a 4-year institution, but I wound up staying on campus and I was pregnant. And I stayed on campus the entire time or the entire semester, left in December and had my son in January 2001. And so it's important for me to share that because for me, I was driven. Even looking back, I was driven at that time to just work hard and find out what was next for me. I finished up at a community college, my nursing program, and then from there took steps. I went from an associate's degree, started working as a nurse, was working in a hospital setting, a GYN oncology unit. They paid for me to go back for my bachelor's degree. I always recommend trying to find an employer that has some tuition reimbursement or assistance program. And then after I got my bachelor's, I went and got my master's in nursing education because I love teaching. I love precepting. I love working with nurses. And then from there, I went and got my family nurse practitioner because I didn't want to be stuck in mainly teaching baccalaureate students, but I wanted that graduate level. We called it 3 Ps, right? Your three, your, you know what? You're gonna have to help me out with this. But
You know,
anyways, I wanted those.
the
Go
three
ahead.
P. Or you know,
Yeah,
like
you
patho,
yeah, patho-pharm, patho-phys,
assessment.
and
Oh, okay.
yeah, and advanced physical
There's so
assessment.
many.
I
There's so
wanted
many.
those advanced yeah, I wanted those advanced classes because I wanted to be able to teach grad students. So I went back for my postmaster's family nurse practitioner, that was 2013. And then eventually I said, you know what? I was in academia. I loved academia at that time. I had transitioned from bedside. I spent about 12 years in home care, which is when I say I fell in love with nursing.
Hmm.
I truly fell in love with nursing when I was going into people's homes and then was exposed to what we call those social determinants of health, where you live, grow, work, play, age, and the impact that that community has on health. And then I went and got my doctorate and got done with that in 2018 from the same institution I got my FNP postmasters. So long journey,
Yeah,
but wouldn't trade it for anything.
that's wonderful. And kudos to you for pushing through, given the challenges, especially so young. Yeah.
Yeah, it was tough. Family, right? Family support. Definitely his father was very supportive. Friends, it takes a village.
Mhm. Oh, yes, it does indeed. And so when you were
Mhm.
in the community college, that's where you got your associates?
Yeah.
And with that, that was like a RN?
Yep. So it was associates or ADN, which is a associate's degree in nursing. And many people can be a nurse with the ADN, but I went back for my BSN, Bachelor's of Science in Nursing, and then the two masters, well, one master's degree, one certificate, and then the DNP. So I
Did you always
started
go
off as like I'm sorry, go ahead.
did you always go full time?
Pretty much. I always went full time and I was always working full time as well. It just wasn't an option for me to do less of either. And again, this is just, my story and what I knew in those moments that I wanted to do. But I was always full time for both work and um, school.
Nice. And so, what was academia like?
Academia has been rewarding. I'm still in academia. It's been since 2012 since I stepped foot in academia as a clinical instructor first, working in the lab, helping students to learn those auscultation skills of listening to blood pressure for the first time and abdominal sounds. And it's really fulfilling to see the aha moment, to see the I got it moment. And then from then, I stepped into the classroom after I got my master's in nursing education. That prepared me to do the pedagogy part of it, right? To help facilitate students or learners in their ability to learn and understand and produce good outcomes. And at the institution I was at, which was University of Rochester, my dean was really supportive of at that time of encouraging me to go back for my doctorate. And in academia, it's encouraged for you to have a terminal degree. We say terminal degree, but in nursing, education never stops, right? We're always learning, we're always growing, we're always expanding, and we should. And I'm still in academia. I'm in a leadership position in academia now. My DMP has afforded me the ability to do so, and just my passion for health equity, which is what my DMP project was based on, looking at cultural and linguistic appropriate services and increasing acute care nurses' level of cultural competency.
Wow.
You know what, Dr. Max?
Wow, that's impressive. So that master's of education, is that master's in nursing education?
Yeah, it's a master's in nursing education. It was a 18-month cohort program.
Okay.
But many of us made it out, some did not. But yeah, it was a great experience again for me to understand how to teach, because I think many times folks go into academia and they don't clinically, right? We're great clinically. We got all this clinical knowledge we can impart, but it's about how do you develop a rubric? How do you create an assignment? What learning management system do you use and how do you use that? How to give feedback to your students? All those things it has taught me and some.
Thank you for sharing that. And I love that you have a master's in education because as we talked with our becoming DNP, Demetrius Kirk,
Mhm.
his master's also is not because it's he mentioned most people think as soon as you say you're a master's that you're a nurse practitioner automatically.
Yeah.
And so I love that both of you have brought to the attention that that's not the case. There are lots of options
Mhm.
when you go to get your graduate education because not everybody wants to continue to,
Yeah.
excel in terms of as a clinician at, in direct patient care, but they still want to continue their professional development.
I agree. So there's masters in nurse leadership, informatics, and technology. That's becoming a big one. Obviously, nursing education. But then I did go back and get my, FNP certificate to support the work that I was doing at that time.
And I love that you talk about the certificate, another way to advance your education.
Yep.
And for that part of your education, were you able to get tuition reimbursement?
For the certificate, I was not, but while I was a faculty member at another institution, there was a HRSA. I can't think of what HRSA stands for right now, but a loan repayment program if you decided to work as nurse faculty. So I had 60% of my loan forgiven in the first 2 years, worked for another third year full time as nurse faculty, and had another 20% forgiven. So 80% was forgiven in about a 3 year, maybe 4 year time frame because I chose to stay in academia, in which I would have anyway. So I went from 100% to 20% that balance, which is a lot.
Oh, actually, I'm so glad you brought that up because as we're filming this, we're both members of DMPs of Color, and
Yes.
last night we were both at a series called Doc Talk, and we had representatives from HRSA sharing all the available options, right, that they can provide.
Hmm. Yep.
And
Nurse faculty loan repayments one, but there's so many options that HRSA gives money for folks to help with loan repayments.
so with the education one, is that tied to clinical practice as well, or you can just solely be teaching and get it?
Yeah, so that one was specifically tied to nursing faculty in higher ed, but I believe there may be some for those who are doing more faculty development, which is another role of uh, that master's in nursing ed can support. So it can support faculty role, it can also support nurse educator role. But every guideline or every time they come out, there may be updates with who is able to receive that. And a lot of paperwork behind it as well. But hey, 80%, I'm gonna roll with it and work on how I'm gonna pay that 20 still.
Well, congratulations.
Congratulations. Thank you.
So you mentioned
So
your
you mentioned
doctoral. I hear my echo. You mentioned your doctoral research. Can you just kind of tell us a little bit more about that? And did you have any barriers to choosing to go that continuing education and also that particular area of research?
yeah. Um, I didn't have really many barriers. My institution that I was working for at that time, again, my dean was really encouraging of me to go for my doctorate. I decided to go to a program that had a weekend format. So we met every other weekend, Friday evening and all day Saturday as a cohort. There were 6 of us, and it worked for me in my life at that time. Remember, I had a son who was in high school at this time, and we actually graduated together. He graduated from high school, and I graduated my DMP, and we took graduation photos together. But so I had to be mindful of that and wanting to be there during the weekdays to support his games and be that cheerleader mom for him. So this weekend format worked for me. So I would say the barrier was, again, the format or looking at times, but this is what worked for me. My project, again, was on the class standards of those cultural linguistic appropriate services. I really had a good experience for my DMP program. Yes, I was the only one. And when I mean the only one, the only person of color, or the only Black person, we did have an Asian American student in there as well. But the institution I was at, I felt very supported as an individual. So I would say I probably had a really good experience overall, not too many barriers.
Oh, wonderful. I love this weekend format.
Yeah.
Nursing is one reason I got into nursing was because it was so flexible. And the longer I stay in, the more I realize how flexible it really is.
Mhm.
Yeah, because there's a
Mhm.
recognition that people have real lives, but
Yeah.
we still need the help, and we're willing to support you to get there.
Yeah, it was tough, because also the classes were like 8-week format. So you were doing a class in like 4 weekends. So you obviously had a lot of work to do, a lot of papers, things like that. But it was a good format because trying to come there in the evenings after working all day, it just wasn't going to happen.
Yeah, I couldn't imagine. So I love you've explained your format. Demetrius, he also has an 8-week format. I don't know if he has the
Okay.
weekend one, but I did the
Hmm.
BSDMP and I did part-time because I also continued to work full-time. And now that I work 5 days a week, I couldn't I couldn't imagine. I couldn't imagine trying to do both of those things.
It's tough. We did have a couple, one BSN to DMP student in our cohort as well. So it was mixed. I also liked about that experience, we took classes with MBA students, so Masters of Business and Administration. Some of our DMP classes were combined with those students. And when we were working on our projects, really thinking about the financial implications and sort of that business aspect of getting your DMP in terms of what you would do with the organization for organization, understanding inputs and outputs and resources and that logic model. It was really helpful for the MBA students to help us with that.
I love that you're getting into the details because, there's people who are thinking about in nursing, we're always encouraged to continue education, right? But we don't always know what that looks like in real life. And especially this DMP, as you know, it's has a little bit of controversy around it. So I love that you're explaining the details of what the experience is and what you're getting from it and how that's different than just our typical clinical education. Like, because
Yeah.
we do more, it's not just about what we do with patients directly, as you mentioned, that bigger system. And so I just love that you're talking about this in detail and giving people a little bit more of an inside look into what this education looks like at this level.
And as you mentioned, DMPs of color, their mission is really around education, to show folks, the roles and various roles of DMP, but taking in consideration that it's not more clinical hours for your NP role, because as you mentioned, all folks going for their DMP may not have a clinical track that they did prior to that. But it's truly about organizational assessment, organizational change, being a change agent and a leader in that space and helping with system changes, and not so much the patient focus, but populations.
Yeah, that's beautiful. I had mentioned all those things that we complain about with direct patient care or giving access to care. That doctorally prepared nurse can do something about it.
Yeah, yeah. Hence our projects, and hopefully they can be sustained in the institutions we implement them at.
Yeah, that project is just a way for us to demonstrate what we're learning. Because I think sometimes there's a bit of confusion too, like, oh, it's just a project. The whole degree is just a project. But it's a demonstration because you're able to display these skills that you're learning, how to identify the system problem, how to implement these
Hmm.
changes, evaluate them on a quick scale, bring teams together, and how central it is and how pivotal you are to that change, right? And you're not
Yeah.
reinventing the wheel. You're taking what's already existing, you're just making it work for this setting.
Yeah. And that's so important too. But then it's also important to remember that you're right. The DNP project is a way for you to show all the collection of stuff you've done, and then you replicate it, right? It may not be that project you replicate, but you understand the processes into how to develop a project to make and implement a change or implement a change.
Yeah, nurses are all about change, right? We know we identify problems very quickly. And I think,
Yeah,
if you haven't pursued your graduate education, this whole systems operations talk might seem a little bit foreign. But I just encourage you to do your research and find out what that means because you actually do understand what we're talking about. That language just hasn't been part of your education and training to this point, but it's something you're experiencing every day you show up for work.
for sure. It's sort of that question of, you may have a inquiry of why do we always do it this way? Why is it that when X, Y, and Z patient comes in, we always send them there? Your DMP project usually derives from a question of inquiry to say, why is it that X, Y, and Z is always happening? And truly look at the policies and the procedures and the processes and make a change to make it better. So you're right, Dr. Madison, you are looking at the issue or the gap, and then your project is to fill in that gap and to change it for the better.
Yeah, and those skills are transferable.
Mhm. Very much so.
So, what's your perspective on the current state of healthcare?
Ooh, um, I'm optimistic and hopeful. I think we do have some challenges, especially with chronic disease, and as people's life expectancy is increasing, chronic diseases are staying around. Although technology has afforded us so much at this point, I think it will continue to allow us to have options to support people where they are in managing chronic disease, as well as managing many of the acute things that we have going on. Um, I think more people are still interested in healthcare in various areas. Nursing, we do know there are shortages, and there are shortages with faculty as well. But I do think with the innovation and the creativity and the technology that we have and that is coming around or coming up, I feel like we're still in a good place. I don't see it as a bad, dark cloud over us per se. It's also not that sunny. If I had to say the weather related to the current state of healthcare, I would say, partly cloudy, but the
Oh,
sun is coming out.
oh, I love that. So on that
Okay.
note, yeah, what would
Yes.
be your advice for actually I might actually steal that. Um, I think it says a lot actually. So what's your advice for aspiring nursing students and yeah, people
Yeah.
who want healthcare?
I would say a couple things. Understand your why
Mhm.
and understand your why to go into nursing, right? Some people will tell you, I'm doing it because it's a stable job, it's for money. That's someone's why. But I think a larger why can be what are you going to also get out of it, as well as what you're going to receive. And understanding that each of these patients have a story, just like you have a story, and just as I'm being allowed to share my story today. We need you, right? Is the other part of what I would tell a nursing student. We need you, and there will be challenges and battles and hills to climb, but you can make it to the other side. As well as nursing is just a very different profession, and so I think it's important for mentorship to be a part of what you will do when you decide to be a nurse, or if you are in nursing or considering your doctorate degree, as having a mentor. Mentorship is so important, and I would not be where I am without mentors from my community college experience to my DMP, and then after that, professionally. So try to find a mentor or mutual relationship y'all can build on, but also folks like a coach and a sponsor, which are a little different than mentors, in order to help you in various areas of your life. Um, and this is your journey, right? And realize it's your journey. It's not going to be like mine. It's not going to be like everyone else's, but ask us questions as well. Have curiosity as much as possible.
Beautiful. And where should someone start if they're looking for a mentor?
You can start a couple places naturally, right? Who's in your circle or who's around you. You don't want to find necessarily a mentor who's at the same level in terms of if you're a second semester nursing student, another second semester nursing student, but maybe a third semester or fourth semester, or someone who's already working as a registered nurse already. So look around your immediate circle. And then I'm going to push nursing, professional nursing organizations. Join your local and state nursing organizations. I'm in Maryland, right? I'm a part of the ANA, American Nurse Association, but also my state chapter, which is the Maryland Nurse Association. I'm also a part of organizations that are more reflective of who I am and my culture, DMPs of color, right? And supporting me in that space and helping me with my scholarship, National Black Nurses Association, right? And all the things that they have done since 1971 when they were originally created. And I feel like I belong to them because of who I identify as. But depending on who you are and your identities and your social identities, who you see yourself as in the morning, you want to connect with professional nursing organizations as well in order to have a mentor. And they also have scholarships that can support you as well financially on this journey.
Beautiful. And so we're going to wrap up by talking about what we can expect from you this year. And since I just learned you're an entrepreneur, I want you to share that with the
Yeah.
audience, your
I
business.
sure will. I sure will. So I had the opportunity to share. I just launched my foot and nail health business. So Foot and Nail Health LLC. It is a mobile foot care business that comes to you in the DMV area, right? I'm not going to too far to California right now, but
Not
it's a
yet.
footwear business, right, that comes to you in terms of providing what we call routine foot care, which is normally trimming of toenails, calluses, and corns. And a lot of that is focused on the educational piece as well. Again, I'm not a podiatrist. I'm a nurse and I'm a certified foot care nurse. And I will refer to podiatry if there's something above my practice. I'm also in the middle of obtaining my certified wound care nurse advanced practice degree to combine wound care with lower extremity or foot care as well. So I love what I'm doing on this journey. Yes, nurse, entrepreneur. I'm sort of giving it the word of socialpreneur because I realize the social justice impact and the impact on my community that this could have, and just the greater good that I will be able to do in collaborating with community-based organizations, getting grants, and being able to offer this service to folks who would normally not be able to afford it out of pocket, but who need it, like those who are experiencing homelessness, folks who are on just limited income for various reasons. I want to provide that service to them. So, nursepreneur, socialpreneur, here I am at Foot and Nail Health.
Beautiful. And so just if someone wants your services, do they just go to your website and you schedule an
Yep.
appointment?
Yep, you can go to my website, www.footandnailhealth.com. I'm on Facebook and Instagram as Foot and Nail Health as well. Easy to remember. You should see a hand or a heart with a foot in the middle. And again, I'm mobile. I come to you. So if you're in the DMV, DC, Maryland, Virginia region, just contact me and we can set up something. I look forward
How
to
far south
servicing
of
you.
Virginia do you drive?
Probably like Northern Virginia, and it would
Okay.
depend. So that will be definitely a conversation.
Oh,
But yeah. Mhm.
wonderful. And who's on your team?
It's just me right now, y'all. But as this business grows, I am sure that there will be more and more of a need. I also precept those who are going for their certified foot care nurse and going for their certified foot care specialist. So you need 40 hours to sit for either of those exams, just about. And so if someone is in need of hours because they're looking at having a foot care nursing as their specialty, you can also reach out to see how we can further get you those hours as well. And yeah, I'm looking forward to this journey. It's just me right now, but this team will grow. I'm optimistic and hopeful of what will come next.
I think you're going to do fabulous. So what can we expect from you this year?
Yeah, so the growth of this business, right, is to be expected this year, and I'm hoping some opportunities with maybe some contracts with government agencies. Publishing, more publishing for me. That's always been a goal of mine to get out there in the literature. I do have 3 or 4 scholarly articles out there now. Most of them are around, foot care and wound care, but looking to do more in the space of combining my DEI hat, so diversity, equity, and inclusion hat, with lower extremity amputation prevention and education. So looking to combine the blend of both my clinical and my sort of academic hats, and more of that. And honestly, better space mentally and physically, focusing more on me in 2024, and some mental clarity, improving my mental health, improving my physical health, and just loving on my family and friends.
I'm so glad you added that piece. Thank you. Thank you for talking about that importance because, when we're in the business of caring for others, so much of our conversation is focused on the patient. And it really also needs to include ourselves, right? Because
Yeah,
burnout is real
it
and it's
is.
important that we practice what we're preaching.
Hmm. So very true. So very true. I'm learning that. And, sometimes you take a few steps back to have that aha moment again, and then move forward. And so I'm hoping that y'all keep me motivated too. Y'all keep me accountable.
Yeah, so I love if you could just make sure you send me those links for your publications. I want to include those in the
Sure.
description box so people can check it out. Thank you for offering your preceptorship. That is a challenge for students, right, to get that kind of guidance and training. And so I appreciate that you extended your time for that. For your services, for your business, are you 5 days a week?
Yeah. So right now I'm not, because that would conflict. But it's usually full 1 day a week for sure, and then weekends, and then I can also accommodate evenings. So as the business grows, I'll have to make that decision with what I want to do with my future in terms of continue this nursepreneurship and entrepreneurship and socialpreneurship journey, or stay in academia. So we'll have to see what comes, but right now, 1 day a week, weekends, evenings, can be accommodating as much as possible.
That we can include Sunday?
Yeah, for me
Oh,
it
okay.
does. Yep, for me it does. Yes.
Okay. Any lasting
Mhm.
thoughts with the audience?
I just thank you, right, for allowing me again to share my nursing journey, and again realizing that everyone's journey is different. Hopefully, this has been a little inspiring to you to realize where I started, where I am, and where I will continue to grow. And just want to remind folks to, if you don't have a mentor, to look at one. Feel free to reach out to me if you desire to get some mentorship, or just to have a conversation about where to start. Happy to have a talking point, or um, a starting point, and then we can go from there.
Beautiful. Thank you. Thank you so much. And you have a beautiful nursing journey. And I know you do a lot of publishing, to advance our field of practice. But I look forward to that publication that's just about you and your story.
Thank you. I appreciate that.
Remember, everyone, you can email us your questions or show ideas to tmi.melanin@gmail.com. If you haven't already, subscribe to our YouTube channel and follow us on every social media platform. When you get there, say hello in the comments. Please share the show with your friends, rate us on the Apple and Spotify podcast. It helps bring us up higher in the search and gets the message to those who really need to hear it. You can find all of our social media links and all the resources we brought up today, including Dr. Conyers' publications, in the description box. We release a new show weekly on TMI Tuesdays at 10 a.m. on YouTube and all your favorite apps. Follow, like, and share. Share the show with your friends. Thank you for watching.